Good morning, everyone. Welcome to INSPINAR, your inspirational seminar. INSPINAR is a 30-minute conversation designed to empower us all with the roadmap for a more peaceful and productive life. I'm your host, Dr. Nidhi Gupta. The question for today's episode of INSPINAR is, where has the grit gone? Where has the grit gone? And to talk to us about grit, parenting in today's world, ADHD, optimizing focus and concentration, we have a renowned ADHD coach and counselor with us, Christine Robinson. Christine is the founder and president of ADD Action Coach. Passion, focus, and her own personal experience drove Christine to start ADHD Action Coach that focuses on ADHD coaching, educational consulting, and advocacy. After her own child was diagnosed with ADHD and dyslexia, she went back to school to earn her master's in education to help navigate her own child's educational struggles. Christine has spent over 17,000 hours coaching children, teens, adults, couples, and college students. A certified teacher and master coach who also has over 20 years of sales and management experience, Christine is considered an expert in her field of ADHD. Christine, welcome to INSPINAR.
Thank you so much, Dr. Gupta. So nice to be here.
Thank you, Christine. I would like to begin by learning more about your journey, your own personal story. What led you to the word of ADHD?
Right. Well, exactly. As you said in the intro, because of my son, I was in telecommunications for years, and he was diagnosed as a young child with ADHD and dyslexia. And I could see even in early elementary school how complicated a process would be to even get him the type of education that he needed, the support that he needed. And I said to myself, I have to go back to school and be equipped to help him. And along that journey, as you know, he got help and testing and different support services in his schools. I met Dr. Hallowell, and then was introduced to the world of ADHD coaching. But first, I was trained by the Federation for Special Needs in Boston on educational advocacy. So even before then, I started working with parents to help and support them in the IEP process, which can, as any parents out there know who have 504 plans or IEPs for their children, is a very complicated process, depending, of course, on your school and your state. And I was there to support those parents through that. And many of those children had ADHD who I was helping in that process. And then some of the parents also divulged that they had ADHD. So I really saw it in the family, which really led me even more to an interest in, of course, then ADHD coaching.
So that is phenomenal, Christine, how you took your own personal experience, your own personal journey, and instead of being bogged down by the diagnosis of ADHD for your child, you took that as a challenge and made it a mission for yourself to help other parents who are probably struggling with the same issue. You mentioned that children who had ADHD, in your discussion with those parents, and you found that the parents then divulged that they have ADHD. Is it a genetic, is there a biological link of ADHD that it is passed on from generation to generation?
It often is, and the same with dyslexia. That's why on the intake process, whenever I meet with any adult or teen, I do ask about family history because it is so important in the process. But right now, in recent years, I have been seeing many more children who have no familial link to ADHD, and that's when I really started looking more into the screens and how I believe screens are changing children's brains, especially if they're overused and especially if it's starting at a very young age.
So how many years ago was it that your son was diagnosed with ADHD, Christine?
Oh, it was about 2003. Yeah.
So almost 20 years ago. So over the
hmm
last 20 years of working in the field of ADHD, do you feel that the entire landscape of ADHD has changed as far as the clinical symptoms that um, patients are now presenting with, the way ADHD is diagnosed, the way ADHD has been managed? Do you think that has evolved over the last 20 years?
Well, certainly, I think some of the medication management processes have gotten better. And of course, doctors in general, I think, are more skilled in prescribing medication. Uh, Also, my son, as well as many of my clients, have done an exercise based program to treat ADHD. So I feel that that has really helped. There's so much brain research now, but the reason why I'm bringing up the screens is that it's also a very important part of my intake, whether I'm meeting with a parent or a college student, because why our time management and organization has changed, I believe, kind of leads you down that path, because once people start looking at their screen time on their phone and they're seeing 5, 6, 7 hours, it really changes the conversation. Whereas when I first started doing that really wasn't even heard of, because I think it was around 2010 when the majority of people started getting smartphones or have iPhones. So that's really when I saw a shift.
In your intake experience, what have you learned in terms of how are people using screens? Some anecdotes of extreme screen time users that might put things in perspective for our listeners.
Well, it really first came on really in my professional life. I think it was, I'm trying to think, maybe around 2011 or 12. I was coaching a young boy and I wasn't treating him for this. This just came out, because I was just helping him with time management and organization and things like that. But that he had a horrible screen addiction to pornography. And that really was my first professional kind of shock at what was evolving and what will evolve in the world of screens. He had very committed parents. I This was just a shock to all of us. And then, of course, I referred him out, and he got the appropriate help that he needed to overcome that addiction.
And I'm not so sure if we have evidence that supports or negates this, but can screen time or excessive screen time play a role in the onset of ADHD, or does excessive screen time probably just play a role in progression of pre-existing ADHD?
It's really hard to say, because when you look at someone's screen usage, um, we have to look at also what they're not doing, right? Because they're on screens. So if a child or a college, just take a college student, isn't getting their work done because they've been on YouTube, until 2 a.m., 3 a.m., it's not because they really can't pay attention. If they just were isolated in a room without screens, they probably could finish that work. But that level of distractibility and the addictive quality of what all of these technology companies have very masterfully done, it's very hard to overcome that piece. So it's really a careful questioning process that I try to go through in terms of what is really impacting that individual, and why are they kind of escaping to screens. Is it avoidance? Do they not even want to be in college? I mean, that's kind of an extreme, conclusion, but I have come to that with certain individuals who I've coached.
It sounds like the screens have become our way of outsourcing our focus, outsourcing our attention, outsourcing our coping mechanism, and outsourcing our grit. Do you think we have the grit to face the challenges that real life has to offer us? If not, where has the grit gone?
Well, that is the $1,000,000 question. Um, I see grit as sticking to something that you really may not want to stick with, but have to. Maybe because of outside reasons. Maybe, you are in a job that you don't really want to be in, but you have to stick with it in order to pay your bills. So you just don't quit. Uh, Grit is sticking to a college class and just plodding through, even though you don't like the material, or maybe you don't like the professor, or even the way it's being taught. But you just don't withdraw from the class and say it's hard. If you can possibly pass it, stick with it. Um, so that's where I see, again, screens interfering with this, because it is such a level of escape. And I'm not just focusing on children and teens when I'm talking about this. I am certainly talking about people in their 30s, 40s, 50s, 60s, even 70s, who, you just get kind of sucked in to these things. And things start going by the wayside, because if you're spending 5, 6, 7 hours a day on your phone or your computer, my gosh, what can you get done?
It's
So,
an easier way out.
right. So it's all of these things, and but I think, I would love to have a more proactive way of dealing with screens in our society, as opposed to people getting addicted, where it's impacting their mental health. I mean, there are so many studies and research that has come out about what Meta in particular has hidden from us, especially regarding young women who have had severe mental health issues and sometimes suicide. And I know that information is finally coming out. And I really just pray that parents are paying attention to that. And, these are good parents that this happens to with their children. It's not people that are neglectful.
Those parents probably need to find their own grit and then teach their children how to find their grit and then hold on to it. So what are some of the things that these parents and can do to to empower their children with the grit that children will need to navigate school, middle school, high school, college, job search? What role can parents play in that without sounding like a helicopter parent?
Right, right. No, we don't want to be helicopters, but I've met with certain parents who have said, well, they're teenagers now, so I don't have to be around quite as much. And see, I just think parenting gets harder, honestly, as kids age, especially in these times, um, because we have to be on this. This is not something that you ever want to leave to chance. Children, teens should not be, on their phones till 3 a.m. in bed if they're living at home. We have to set standards, but we also have to be a role model. I once had a client who came to me, and her children were very small, like 2 and 4. And she came to me trying to reduce her own screen time, because her little girl came up to her in the kitchen one day and said, Mommy, why are you always looking at this and not looking at me? And that really hit home with her in a very impactful way. And I think as parents, we have to be present. Just because you're in a home doesn't mean that you're present. And I know it's hard to do this 100% of the time. Nobody's perfect. But if we're on our phone and our devices all the time, or our parents are playing video games, how can we possibly tell our children not to? And we have to find those replacement activities, whether they're hobbies, exercise, just going outside and playing when kids are small. I mean, I can drive around neighborhoods, Dr. Gupta, in any, just any place in the country. You can count on one hand how many children you see outside. You could be driving around for 2 hours and maybe see 5 kids, maybe.
That is so true. That is so different from the way my own childhood was. And that's the evolution of modern parenting. So are there some features of modern parenting that are better than the previous generation? And are there some features that are not so good compared to the previous generation?
Oh, it's hard to say what's really better. I mean, it, of course, the access of technology has, good points to it. Of course, I use an iPhone and a computer, and I need these for my work. But the difference is, I personally really see these things as work devices. I don't really see these things as, pleasure, so to speak. I mean, I go on Facebook and Instagram maybe 10 to 15 minutes a day. I post some things for work. I'll read some friends' things and I'm off. And I think one of the main things or very big things that we could teach our children is to ask these questions. If I'm on social media, for instance, ask yourself after 10 or 15 minutes, what am I getting out of this? Usually nothing or very little. Um, how is this making me feel? Because every minute that we spend on social media raises our risk of anxiety and depression. And then, third question, what can I be doing instead to enhance, improve my life, and get things done for me or for my family, obviously? So it's, if we keep on asking ourselves, even if we don't feel like we have a screen addiction, those are very important questions because, spending even an hour a day on your phone, and then people will come to me and say, well, I don't have time to exercise, for instance. Exercise is a huge part of our health, especially for those diagnosed with ADHD, whether you're 10 or you're 50. You have to be exercising because it really will make you feel better and decrease your symptoms. So we have to find those times. We all have busy lives, but we have to find those times to take advantage of the things that we need to do for us.
That is so true, Christine. And you mentioned that exercise is especially important for those who have ADHD or those who might have ADHD. What else, in terms of lifestyle, in terms of organization, in terms of routines and schedule, what else can people who might have ADHD or have ADHD do to improve their quality of life?
Well, if they don't have a diagnosis and they do suspect one, they probably should, seek a professional out for that diagnosis because, if medication does make sense for them, absolutely, look into that. If not, of course, there's more natural ways to treat ADHD as well. But it's always good to know, really what's going on and to get that professional diagnosis. Um, Oftentimes, when I first start meeting with a new client, I'll ask them to keep a record of their day. So, very simple process. Just take a blank sheet of paper and just put the hours of the day 9 to 10, 10 to 11, and just record what you're doing so you can really see where your time is going. And sometimes that's very shocking to people because, a lot of my clients will come to me and say, I don't even know where the day went, right? And so we have to kind of do a forensic report on that to really figure out where the day is going so we can adjust accordingly and really try to get some structure of the day and to really start to instill habits because it takes a long time to build a habit.
That it sounds ironical to me that a person who might have ADHD I wonder how hard or challenging it would be to write down on a piece of paper what they are doing on an hourly basis to begin
Well,
with.
it's not easy, but I usually ask them to set the alarm on their phone or some kind of timer device, probably their phone, but at least that reminder will go off so they can just write, just a few words on what they did. But it's a really valuable exercise.
And why
Um,
why is it valuable? Is there any executive functioning skill that is missing? Is time management, is organization something that they fall behind? Is that why going into this practice, making this a habit, making it a routine, is that
mhm.
why it is important?
Absolutely. I mean, executive function skills have to be practiced, and that's why if you do suspect your child has ADHD, it's just so important to catch this early, so you can start to really build these habits and make them aware of time. Even a clock, an analog clock with hands, so people can see the passage of time. It's a very different experience, and I've had many of my clients do that too because a digital clock doesn't make you feel the same. And I know for, maybe some young people out there that are listening, they're like, what is she talking about? But you can really see that passage of time from 12:15 to 12:30, as opposed to just seeing the numbers.
That is true. A wall clock, an analog wall clock, a wristwatch, which actually has the moving hands of the seconds, the minutes, and the
Hmm.
hours, instead of a smartwatch that just tells you a number. That is so important. That's fantastic. That's fantastic. So I want to pause here a little bit. I
Yes.
have numerous questions for you, Christine, but I want to
Oh,
pause
okay.
here and see if we have any questions
Hmm.
from the audience.
Sure.
Okay, so I have one more question, and I have plenty of
Hmm.
questions, but we'll see how
Sure.
many we get covered in the short amount of
Yes.
time that we have with you. When it comes to ADHD, Christine, we often focus on children.
Hmm.
And earlier in your conversation, you mentioned it's not just about children, it's about people who are in their 30s, 40s, 50s, and 60s. I think that was mentioned more in the context of screen time. But
Hmm.
is adult ADHD a thing? Or is that ADHD that went undiagnosed in childhood and is now being found in adulthood, or it had its onset during adulthood?
Well, typically, the hallmark signs of ADHD are in childhood. And certainly, I want to make this distinction because many children who have ADHD do very well in school, and that's why they're not getting diagnosed. I will have adults telling me and reporting their history. In high school, they basically did no homework because they didn't have to, because they were so smart. They never studied. So they never even had to practice the things that other children or teens had to practice to get to the point. So then when they get to college and the work becomes more difficult and more layered, and you have many more things to handle independently, that's when many of my clients get diagnosed in college. Or I have other clients who have made it through high school and college without any diagnosis, no treatment for ADHD at all, but then get into a job or career where they have to use so many levels of executive function to be successful. And then that becomes overwhelming to them. So I always think the hallmark signs are there if you really get into a person's history. But of course, you could have the person who had maybe a very slight case of ADHD, but then discovers screens or video games at 18 or 16. And then they're kind of off the charts in terms of their, ability or lack of ability to function day to day.
Do you think these children who are able to perform so exceptionally well in school is because they have a structure that has been put in place for them during school. And once they graduate from school, that structure falls apart, their parental
Yes.
supervision falls apart, and now they're on their own to figure it out for themselves.
Oh, absolutely. Many of my clients have said, my moms are fantastic. She put everything together for me, which is fine. But then they didn't have that time to practice and either fail or succeed in that process. So that's why college for a lot of my clients is very difficult. And then, and then they experience college life and maybe, non-prescription drugs. So now they're self-medicating with alcohol, marijuana, whatever. And then that leads to other things and other problems. I mean, research shows that people who have been diagnosed with ADHD have, more propensity to addictions. That's just a research fact. So that's always on my radar when I'm coaching any of my clients, so that, I have to know what they're doing recreationally, because of course it's going to impact everything.
What are some of the non-medicational management options for ADHD? I know you mentioned some practices. Could you elaborate a little bit more on those, Christine?
hmm Well, really, just the first thing is exercise. People have to be getting fresh air. They have to be going on walks. They have to be in nature at least snippets of time around the week. Having a sedentary lifestyle is probably one of the worst things a person diagnosed with ADHD can do, because that could also obviously lead to overeating and then being overweight, and then a myriad of other health problems will turn to that. But structured exercise is one of the things I focus on a lot. Um, just good diet and nutrition. Um, Many people with ADHD have problems, kind of putting meals together. So sometimes we work on that, because you do need a level of executive function just to kind of make food, recipes, cooking. And, a lot of takeout food or restaurant food is not always the healthiest. So we work on that as well.
Excellent. There is so much to be learned about ADHD, so much important stuff that you shared with us today, Christine. Thank you so much. Thank you, thank you, thank you. Is there any parting message that you would like to share with our audience?
Well, definitely, if you suspect something, especially with your child, seek professional help. Don't guess. As a parent, you know, things do get harder as your child gets older, especially if you're not addressing something. So, don't be afraid to ask them what they're watching, what they're listening to, especially, in their early teen years, because it's a very frightful landscape out there. And, we as parents have got to be in tune of what's going on.
Parents have to find their own grit so
Yes.
that they can help their children find their grit and stick with it.
hmm
So
Yes.
true. Thank you, Christine. Thank you so much. And thank you, everyone, for making time to join us on INSPINAR today. Thank you for moving things around on your calendar and listening into this fantastic conversation. Let's reconnect with the real world. Let's reconnect with what truly matters. Let's reconnect with health, joy, efficiency. Let's find our grit. Let's ungrip devices and grip life. I will see you in the year 2023. Thank you.
Thank you.